Drug overdoses are skyrocketing across the country and in Virginia. According to the state medical examiner, fatal overdoses in the Commonwealth increased 38% between 2015 and 2016. The alarming jump attributed to the abuse of opioids, heroin, and prescription fentanyl. Now, this might surprise you, but the opioid epidemic has actually led to a record number of life-saving transplants. Tonight, a doctor at the Mayo Clinic shows us the huge impact it's having.
The images are jolting. The consequences can be deadly. Last year, opioid deaths increased 55% to 64,000 people across the U.S. The victims, often young and otherwise healthy.
In the past, people were sometimes reluctant to use these as donors because of concerns either with regards to the organ quality or with regards to risk of transmission.
Meet Dr. Christopher Kroom. He performs organ transplants at the Mayo Clinic in Jacksonville, Florida. He sees firsthand the impact the opioid epidemic is having.
I think now it's about 25% of our transplants are coming from people who've had drug-related deaths. We're doing probably close to 400 transplants a year, so that's about 100 extra people that receive organs because of it.
Every year, thousands die waiting for a transplant. Right now, more than 127,000 people are waiting for one. Consider this. A single donor can potentially save 8 lives.
I mean, I've seen the lives of those people be changed, and they always say they feel so blessed and so happy to have had somebody that's given them that gift.
As opioid-related deaths climb, so do organ donations. 2016 marked a new record high for the 4th consecutive year for organ transplants.
Over the last couple years, there's been 1,000 increased donors nationally, and almost 50% of that has been related to drug overdoses.
In the past, those organs were often not used in transplants because doctors did not know how they would function, and patients were skeptical of getting diseases like Hep C and HIV. But that is changing. Since 2012, Dr. Kroom says there have only been 4 documented cases of hepatitis C transmission unintentionally from a donor to a recipient, and no cases of HIV transmission. Patients must give their consent before receiving an organ from someone who has died of an overdose. Research being conducted at the Mayo Clinic shows what can happen if a patient waiting for a liver transplant turns one down.
If you declined one of those organs, your risk of mortality was almost twice as high compared to someone who accepted it.
For families who lose loved ones to opioids, giving the gift of life can help them see something positive come from something so tragic.
Well, obviously, with any organ donation, there's a tragedy that is preceded, so nobody wants to see organ donors in that sense. But I think when it happens, and if families are wanting to move forward and really help some people, it can do a lot of good.
Now think about this. Despite the increase in organ donations, on average, 20 people die every day while waiting for a transplant. That could be your mom or dad, your child or your neighbor. Sign up to be a donor. It's easy. It's just a click of the button.